Hello, hello
Hello.
everyone, and welcome to another episode of Coffee with the CEO, season two, episode one. I hope you are well back from your um, healthy summer holidays. You have got all the vitamin D stored up under your skin for the winter season, and to add some extra. Uh, Vitamins of wisdom. We are having today this coffee with the CEO session, focusing on how you could better build healthcare apps. And I'm very happy to have here today uh, Przemek Grzywa. This is a bit tongue twister name, who is having quite some experience building and helping other founders to build various health tech startups with his company Revolve, where they help with different software solutions, helping to code. The let's say medical founders to put those medical ideas into the computer code and execute the ideas for different healthcare solutions in the digital world. So welcome to our show today.
Hello, Timo. Hello to everybody.
And maybe also a quick tour that everybody who is dialing in today, you can put in the chat below where are you dialing in from, and also if you are maybe a technical founder, or if you are like, are you having your startup in the first place, and if so, then what kind of background do you have? So we could see who are who are dialing in today into the coffee session. But maybe to get it started, I think people are maybe still warming up. Maybe the coffee machines are grinding in the background in the offices, either in a real office or a home office. Maybe you can also do a bit deeper introduction. What are you currently up to? Um, and and what would be maybe the good questions that people could yeah, keep it going.
hmm So once again, it's very happy to be here today. My name is Przemek Grzywa, it's always a funny when I'm traveling around and reading my name, pronouncing my name. It's always a fun activity. One time, I remember I was at the conference outside of Poland. I gave my card. Somebody looked at my card and said, "Wow, that's a nice password." And I know that it might be tricky for people who are not familiar with Polish language, which is said to be one of the most challenging languages in the world. But anyway, thank you, Timo, for your kind introduction. I have co-founded Revolve Healthcare together with my two co-founders 7 years ago. At that time, we were a software development agency, designing software for different types of customers from different industries. And 4 years ago, we decided that we want to focus on healthcare and life science area to help founders from medical area to help them design digital health products and then build it into web platforms or mobile applications. And that's what we are doing today. And hopefully I can bring some of the lessons that we have learned throughout our work with different types of customers, big companies, but also startups. We have learned a little bit, and I'll be happy to share some of it. I hope it is going to be interesting. But to make it more interesting, it will be really nice to have some questions, some insights, highlights from people who are also with us today. So if you have anything specific that you would like to raise, question or comment, please use the chat box. We also have the opportunity of, you can also dial in. I mean, we can bring you to stage if you would like to also to maybe ask something more personal rather than the chat. Please let us know. We'll be happy to bring you to kind of like to be more interactive rather than a monologue or a dialogue. It would be nice to have more people involved.
Yes, I hope, yeah, everybody dialing in today have this courage. I know some of you are doctors, maybe as well, and it's just like it can be scary, maybe going to the doctor's appointment. But Dr. Brosmek, the technical doctor of startups, today is here, and it's a safe environment where you can really ask and I think sometimes this is kind of the human learning that usually people learn sadly through mistakes, but this is a great opportunity here today, maybe to get a fast track and get through. I mean, avoid making those mistakes from these kind of valuable lessons that Przemek and his company has got through the 7 years of operations. But maybe to first get started, I see that maybe people are still thinking in their head. What are the questions they want to ask? Maybe first thing is that, I mean, you probably have seen through those different experiences that certain things are more frequent than others. So if we are just getting it started, what is the biggest mistake that you kind of usually see digital health founders making? Is there a common mistake you kind of see through different ventures that more or less every company makes, or what is the situation? Or you see like every company is making more or less different mistakes in that sense? Do we have a pandemic of mistakes, or there are some epidemic? I mean, some kind of like isolated incidents across the board.
I would say there is one big challenge, especially that founders within life science area are facing, and it's maybe not a kind of like a mistake. It's rather a challenge that you have to kind of like cope somehow with, and it's you need a right mix of people. And usually, when you start a company, is the right mix of founders that cover different areas. And when you think about building a digital application, a web platform, or a mobile application, then obviously you need somebody with a technical background. But when you add a next level of complexity, which is medical area and regulatory area, then you have to have somebody who is also covering that area of expertise. So the right mix of founders, or the right mix of people from the very beginning of the company is a challenge, and you might find that difficult to comprehend. But sometimes we have faced, just to give you an example, a technology startup without a CTO, for example, or a healthcare startup without medical background, or a medical startup without CE experience, or MDR experience, or SaaS company without software engineers. It doesn't mean that these companies failed. It just means that sometimes it's not about doing things by the book, especially from the very beginning, but it's rather persistency, and being focused of what you want to do, and knowing where are the gaps, and then you can fill the gaps working with external companies, for example, to some extent, or you know that you need a CTO. You are, well, maybe you are not there yet in terms of to maybe there is nobody that you could actually hire or invite as a co-founder. Maybe you don't have a budget enough to have that, to have a CTO right now, but you know that you will need that within the next 6 months, for example, or 12 months. So then you can think about it. You can find some interim solution, and then within the next couple of months, you can maybe hire somebody. So that's the biggest challenge: the right mix of people, the right mix of competences from the very early stage. And again, within medical area, this is even more challenging because you have to have somebody, and usually when you have a strong medical competence on board, then you have a smaller competences from the technological point of view, and then the other way around as well. You have a strong technical team that know how to build, how to design and build a digital product, but you lack some medical experience. So and you don't have to have sometimes you can cover these gaps with mentors, advisors, somebody that you can invite to help you build the company, but it's not going to be a permanent work for somebody.
Yeah, so it's finding like a good recipe that, it's being healthy. You need a good sleep and like good food and like a bit of exercise. So it's the same, that you need the regulator ideas, the technical skills, and the medical skills combined. Yeah. Well, I see we have got, I think, one just comment. I think it's like, I think one of the participants is writing code in SQL for electronic health records. I think actually electronic health records, this is a very interesting topic that I think, if I'm not, I mean, it's like maybe even going out of Europe. But I think I was reading somewhere that in the US, the third leading cause of death is not having access to the health records in good time, because I think there is not the kind of common standard and access. Have you developed something related to the electronic health records that one of the participants are currently working on?
I don't think we have developed anything which is directly connected. Sometimes we are, or our customers are, integrating with the records in one or the other country. It's still that the big problem we have in Europe is still there are different. The standards are different. The systems are different. Hospitals wants to work on local servers rather than going to the cloud. So then it's different to do some remote work. We still have kind of like a big discussion and debate in Europe about the US-based cloud providers in terms of the data privacy and security. You can read different opinions about that, to what extent you can use or you cannot use with medical data. The US-based cloud providers like Amazon, Microsoft, or Google. So I would say that there is a lot of challenges on the market in terms of the fragmentation and lack of unified standards from the perspective. I'm obviously kind of like talking about the electronic or digital aspects of building digital products in Europe.
Yeah, I think, and probably that's something also that has to be kind of, I would say maybe this is even like the infrastructure questions that have to solve on the political level before we can as the startups we can build something for the common market. But I think you have
I can
been.
suggest one thing from this
Yeah.
perspective. What if you are concerning, and let's talk about this data privacy and security. So if you know that there is some concerns about American-based cloud providers, obviously you can use EU-based, but you can also use the American servers or cloud providers. But from the very beginning, you can design it in a way that you can move it, well, maybe not totally painless, but at least you can move it to another cloud provider in the future if that requires, the regulation requires that. So if you think about it from the very early stage, you can get prepared to that, and then when you face when your product is scaling up fast, and then you realize that maybe you need to use another cloud provider, then if you have planned that for that from the very beginning, then you can change it.
Easy migration in that sense.
Yeah. Mm-hmm.
Well, that sounds like a fundamental data strategy that should. That's again. I think this is one of the insights that maybe lesson one of the lesson number two. First lesson I think was that you have to have the right mix of talent, either in-house or bought in as a service provider or as a mentor to cover those different areas. And then this could be maybe the lesson number two, that already in the early days, think about your data strategy. Where do you have to store the data, and is it migration ready, that if needed you can transfer it. Yes, I'm very happy to see that people are getting busy in the chat and commenting here. I see um, Christiana is asking if I mean, she's kind of concerned on the uh, how to kind of basically design solutions where the target customer is not the same as the end user. So it's like this B2B kind of business model where maybe like you are designing the product that is bought by let's say a hospital system, but it's used by a patient or like whatever other way. Do you have any thoughts on this? I think she's also clarifying that it's probably like how like maybe what are your words of wisdoms regarding the business models, that how
I can try to address it, and it's actually it concerns a little bit the previous point that we have talked, which is planning from the very early stage. And um, uh, it's one of the mistakes also that we are observing. So not enough effort and energy goes into the planning stage, which might take several weeks, several months, or even more if you really want to develop something which touches a quite complex issue. So if you have different stakeholders, what we are suggesting is to involve these different stakeholders in the design process on the early stage. Do the research, ask questions, get their feedback. You can test the solution without building it into the existing application. You can test it with some sketches and drawings. You can test it by asking questions, and the earlier you include your stakeholders, user, patients, or different stakeholders, is the better. And the big mistakes is when you do not do that. Even if you are your own future user, because sometimes it is that you are a PhD, a doctor, and you are developing a solution for doctors, right? But still you are covering your kind of, and you think that you understand the target group to some extent, yes. But if you are a male 45 years old, working for 20 years, then you probably understand this group of males within age 40 to 50 on similar level of your professional development. But there are early adopters, there are later adopters. So it's good to involve the future user into the design stage, include their feedback, and then test it, and then do again the next iteration. You do again, you involve users to show what you have changed, and then ask about the feedback, and then you do that again. You provide that changes to your product, and then you ask the same. So it's a constant way of you want to have a constant loop of feedback from your future users. And that would be, and if you have different groups, then you just simply invite these different groups into the product design. And that's the best way to avoid mistakes in building something which nobody will use, or building something which is kind of like a perfect, but somehow is people are not using it. So there is not the problem with the problem is kind of like addressed very well, but the usability of the product is not very well designed, and people are simply are getting lost with using application, or they are not very involved into the tool. So then you also want to get that feedback as soon as possible, to include that, and then ask again about the feedback.
And to follow up, actually, I see Christiana is adding that, like, as you mentioned, that they should be involved, like those different groups. She's trying to clarify, can you have like a same workshop involving all the different stakeholders, or is it better to do one-to-ones, that you, for example, do like one-to-one showing the app idea, or maybe the sketches first, I don't know, to the patients, then do a different session with, I don't know, the doctors or the nurses, um, or it's better to put them all in the same room and then hear what maybe they are like having discussions even between the stakeholder groups.
I'm not a UX expert myself, but what I can kind of like looking back into our experience is that you want to have a separate groups for different stakeholders, unless they are using exactly the same functionalities. But I think it's not the case. It's usually a little bit different aspects of the platform. Patients are using mobile application, doctors are using web application, for example, just to give an example of, and then you have two different tools actually. So obviously these tools are connected, but from the design point of view, these are completely two different systems.
Okay, so lesson number 3, I think, then it's like do those like stakeholder engagement sessions and do them separately based on the functional roles. But coming back maybe to part of the earlier question was also the kind of the business model part. So I know that, number of European startups, they might get, for the first phases, okay, they might get a grant to kind of build the prototype, or to get it just going, the first 50,000, 100,000, or in some cases, EIC can also support maybe 1 million or 2. But coming back to the business model, so have you seen some kind of good approaches there, that okay, you get the patients to use it, you get the doctors to use it, but then in the first year, even maybe you're running on a grant, how to get really also to make sure that in the future, even though the doctors love it and the patients like it, um, it's going to be paid for. So how to overcome that kind of technical challenge, that it would be really sustainable and people are also paying that. It's not just a nice thing that works, but also the administrators who maybe don't see the solution at all, but are the ones who are doing the procurement for the healthcare system, that are also on board and willing to give those tens and thousands of euros or whatever the amount is, for the company making that.
So first thing is sometimes that the requirement of the institution that is providing grant is that, well, there are some formal requirements that, for example, you have to incorporate in a given country, right? So that's one of the things that sometimes you have to focus on a given country if you are if you want to have a grant from a given institution. Sometimes the incubator or accelerators, they do the same when they are providing some funding. Sometimes it's equity free, sometimes it's not, depending on different approaches. So that's one thing. The business model. I'm not an expert in business models, and I see that there are so many possibilities depending on who is your target group. Sometimes patients are the users, but the payers are institutions like insurance companies, for example. In Germany, and also I think soon in France, in Belgium, Netherlands, I think is also considering is the digital. There is in Germany it's called DIGA, which is the digital apps for prescription. It's a regulation that you can apply to become to officially become one of the apps that is financed from the national health insurance. So then you can, and one of our customers from Poland actually is preparing to enroll. They want to become one of the DIGAs. So that can be your business model, that you want to, part of the business model is going to be paid by, or will be, the money will be coming from the health insurance in Germany, if you are successful to get on the list. That's, I would say, that's just first step. I would say it's already a success if you are one of the successful application on the German approved list by the German Ministry of Health, but that's not the biggest challenge. I would say the biggest challenge is really the ability to the German doctors, they need to know that there is an application that they can prescribe. They need to understand why they should prescribe it. It's funnily enough, I'm not sure if that's still working like that, but in the very beginning, when they launched that program in Germany, I think 2 years ago, doctors were still prescribing digital apps on paper. So you were given a traditional paper prescription with the name of the application that you can use as a digital therapeutic. So that's funny, right? But it means that doctors have to understand what are the benefits of your application to their patients.
Yeah, I see that one of the participants dialing in, Dagmara, says that there is in addition to the DIGA, there is another regulation as well, and these paper prescriptions for digital products are still happening. So nothing has changed, and I don't know. Maybe they will print out the QR code to download the app then on that. um, but that's probably one of the bottlenecks to overcome. Everybody dialing in today, feel free if you have some more questions. You can see like Christian, Ipek, Dagmara, and Diba is like, this is the most appropriate time to just like put your questions here in the chat so we could discuss them. So
I
don't
can
be
maybe
shy.
I can maybe relate to Ipek question because it's a
Yeah.
follow-up, I would say, follow-up question to Christiana, and my answer will be it depends. So what is the ideal level of stakeholder engagement during the app design stage? It depends. The product design stage is a complex process, and depending on your goals that you have, depending on the, let's say, importance of different stakeholders, you then address different stakeholders in a little bit different approach, a little bit different time, a different the level of involvement is different. But you do that first is kind of like you start with the internal discussion, internal workshop to understand from going from the business perspective to more detailed description of the functionalities. You have to start with obviously with the challenge, and then what is your solution, and then who are different stakeholders, and to what extent and when we want to get involved with some of them. But usually the product design process is a little bit different depending on the type of the company, the type of the product, the type of the application, and it's rather a mutual, I would say, mutual agreement how to run it, whether you have your internal designers that can lead that process, or you are hiring external company that can lead you through that process. Is usually a dialogue. Okay, what do we need? How do we want to solve it? And based on that dialogue, you set up the process to address different stakeholders depending on the level of involvement throughout the project.
I see that at following this discussion, Christina is also asking further that is there a good recipe to manage that constant iteration that the solution must have things on the market versus. I see
maybe there
that.
was. Mm-hmm.
Yeah,
Go
it's
on,
like
Timo.
maybe to generalize it, it's just like um, it's like, okay, basically in the context of medical device certification. So it's like how to kind of manage those kind of maybe the needs and the ideas coming from the users, and then having also the reality check that you can build certain things, but as they have to also be, let's say, in line with the regulation, how to kind of manage that everything together. That maybe the user says that I want this, but and I would really like to use it, but maybe that's something that is not allowed even with the regulation. Even you would be happy to code it. Then how to put this process into kind of a manageable flow that having that reality check and also getting those good ideas coming in that
So
people really use it.
one thing that you want to avoid is to include a bigger changes to your product, to your application that will change the intended use, right? So how do you? There are certain things you can do to overcome it, or at least to try to kind of like decrease the risk that it happens. One of the things is again planning. So from the very early stage. You want to put your product on the market within the next, I don't know, 12, 18, 24 months. You want to get a CE marking. You need to comply with MDR regulation, and also probably you will have to go through the ISO certification as a company. But you don't have to do that everything from day one, right? So especially when you are starting a company, it's good to have a good understanding what is going to happen within, and what are the requirements from a regulatory and compliance point of view. But it doesn't mean that from day one, when you start the company, you need to be certified, you need to comply with all the regulations. You are a startup, so you can do that slowly. Obviously, when you want to put your product on the market and sell it to patients or to hospitals, or then obviously you need to be certified. But you can do the design, the testing. You can do that without being certified. And that would be one of the probably things I would recommend, to kind of like understand, to be sure that you understand the regulation, but also be aware that you don't have to be very certified from day one of your company. You have to plan for it. And right now, unfortunately, you have to plan ahead, because notified body in Europe, they are like, there is a long waiting list when you want to get certification. So that's something which is a little bit of a blockage right now, a blocker for founders in Europe. So again, you have to plan it, but doesn't mean that you are kind of like, you have to do that right away. Especially when you think about some MVP stage, you don't have to be, and that MVP is more to show that your idea is working, that people are like, you can get feedback from potential users. You want to show it to potential investors. You don't have to be certified to do that. And then coming back to the question about the intended use, and what I was saying is that if you are providing smaller changes that doesn't change the intended use, that you are kind of like safe after the certification, but bigger changes to the product, when you change the functionalities, when you change the risk, because the usually the certification is about the risk management. When you change the risk, if the risk is higher for patient, then probably you will need to change the category of your product, which is kind of like it's not a kind of like a very easy thing. So that's a challenging thing, Christiana. That's true, that when you have a medical product, bringing bigger changes, that includes also changes to your certification and to a category of your of the product.
Awesome. So yeah, staying safe in a way that use those sandboxes to make sure that things work, and then if you know that okay, it should work, then get it certified before getting to the real life usage, and getting your accounting code to get paid through DIGA or other insurance schemes. That's great. Again, like if you have some more questions to dig deeper, put it in the chat. Uh, Happy to have everybody participating today, and great to have those real life questions and real life answers based on the experience. One thing maybe that maybe goes back to the philosophy is that I think sometimes I have been like working with different founders from Asia, Europe, and the US. I see that sometimes the European founders are really focused on the perfection, and sometimes I think some people that are also coming from the research, they know like, oh, this is not perfect yet, maybe let me take 5 years uh, uh, to get it before we kind of launch it. What do you think is that kind of good sense of urgency that the founders should have while building the health gaps? That I think you mentioned a bit earlier, that good go to market is something like a year or 2 years. What kind of like challenge or like mistakes you see in this kind of time horizon? That are the founders kind of sensing the urgency fast enough, or are they more like trying to do it too fast? That are they on the right speed, so to say?
Well, the bigger challenge, which medical founders are facing, is that we are working in the medical field. I would say my opinion is that the the higher your product in terms of category is going to be. So we have 1, 2A, 2B, and 3. The higher the risk is. 1 is being the lowest, 3 is being the highest risk for the patient. So it's kind of like probably easy to follow that if the bigger the risk, the more accurate you have to be, the more accuracy, security, and you have to be sure that your product is safe, right? If you are building a well-being app, a lifestyle app, which is going to be covered by the first category, then you can be much quicker to the market. You just go through kind of like a self-certification. If you are 2A and higher, you have to go with the external notified body to certify your product, which makes the process much more longer for you. So we have noticed. I'm not sure if that's good or bad, but after the changes in the EU regulation, and by changes I mean launching medical device regulation in Europe, which happens, I think it was 2 years ago. Right now, I mentioned notified body there are not enough notified body in Europe to cover the demand for their services. It means that you have to stand in long line to get to your certification, which means that your road to the market is getting longer and longer. So what we have noticed, and I have even heard that from a couple of startups, that they were advised by VCs to wait a little bit with the certification process. Start with the first category of the product, so being a more lifestyle, well-being app instead of being a medical app. Wait for the market to kind of like be ready for usually when there are new changes. So there is a little bit of a chaos on the market. So kind of like wait 1 or 2 years and then get certification for your product to become a medical product. So that's one of the strategies I've heard. So start with first category and then go higher. That's not always possible, depending on what is your product. But I've heard that these are the strategies to shorten this way to the market.
Yeah, because I think in the end of the day, this all gets down to business. That I think the earlier you can charge, the better it is. Like, I mean, if you are putting money in and you don't have a certification, but or maybe have you even seen situations where founders have found something that I don't know, patients or somebody else are willing to pay even when it's not certified, if they are maybe solving, like, let's say, serious enough problem that that maybe some people just don't care, that as long as it's solving the problem, they are willing to pay, or how often to, for example, see that people are even willing to prepay. I think it's more. I'm not sure about the healthcare industry, especially here in Europe, but I think I have heard that some startups are even great in a way that they're secure, like paying contracts before building things. That how much have you seen while working in the field?
Well, I can. One thing there is for sure I can tell is that if you have a paying customers, or if you know that there are a list of patients waiting just for the release, and they will pay for your solution. That's it's it's the probability of the success is much higher, because then at least you have proven that people want to use it, that you have solved one of the challenges patients have, and that's amazing if you have that feedback. And then if you have that feedback, if you have people that are on the waiting list, or even using the app, even if it's not yet certified, because it's a more lifestyle, then that's a big. Usually, what investors are asking for is the traction. What is your sales history? What are the figures behind the app in terms of how many people are using it, how many people are coming back and use it? Is that figure growing? And if you can show that people are actually interested in using or are using it, this is a very strong point for investors to kind of like take you to the next level.
So I hope you get, like everybody listening in today, you get the inspiration that it is possible, and hopefully, when you have those uh, sessions with your stakeholders, that I hope you found something so awesome that they're like willing to prepay you and like helping you to finance those next steps of development, and including the later certification process if that's required. Awesome. If anyone, again, like you have some more questions, feel free to dive in. I see that actually we have also one more question regarding DIGA, that one participant has not heard about DIGA before. Maybe if you know it a bit better, can you explain it in maybe a few sentences?
So DIGA is a regulation in Germany that allows doctors to prescribe digital application to patients, and that sounds very, I would say, simple. But obviously you need to go through a kind of like a rigid process to get on that list, official list that is I would say covered by or organized by Ministry of Health in Germany. I think right now there are around 30 or 40 maximum applications on that list. It's all official. You can Google DIGA, and then you can find that list on the internet. And when you find that list, you can go through different companies and see what kind of product they have, what kind of challenge they are solving, and what is the way they are kind of like building and designing the product. There are a couple of challenges when you want to get on that list. Security, privacy is very big concern. So you have to be sure that you are designing and building your product that's going to be safe for patients. There is a very good guidebook in English also for companies that wants to enroll. I think that if you want to enroll, then probably you need to go through that process in German, and that's also kind of like obvious. It's going to be for German patients. So then it's you can kind of like learn about it in English, but then you'd rather have to have a stronger presence in Germany if you want to kind of like become one of the DIGAs. But definitely this is and as I said, probably next year I think France will follow. I know Belgium is also considering that. Poland is also the Ministry of Health in Poland. It's also on the list of things for the next, I think, 2 years. So probably in the next couple of years, and this is kind of like a good, probably a message from the market is that somewhere within the next 2 or 3 years, the national health insurance in different countries will also be kind of like a good market strategy in terms of getting financing for your product. So not patients, but well, insurance companies or national health organizations from different countries will be paying for the prescription of your digital apps.
Cool. So I think that's a very good also like know-how information for all the kind of current founders or maybe future founders dialing in that that basically almost every country in Europe is getting ready for that. So it's just being there at the right moment and like having that good documentation ready so you could like submit it in the required language. Maybe this even comes back to the I think the first point that was like having that balanced team, that having team that can also speak different languages that kind of follow up that bureaucracy from France to Germany and Poland and beyond all the places.
There is one more thing, which is, I think, important when you think about strategies of your of the scaling of the product. When you start building your product and you start with a product design, you hire your first engineers, you work with, you focus on the tech side, and it seems that this is the most complex and most challenging things that will happen because the product itself is complex because you are using I don't know, AI algorithms or wearables or a very in-depth study about one or the other diseases. But the tech part, and believe me, the technology part is if you have the right people on board or if you have the right partner to do that for you, that's not a challenging thing. The challenging thing is marketing and sales, especially when you think about, for example, German market, and you get on that list, DIGA list. It doesn't mean that you are going to be successful, because it doesn't mean that all the doctors in Germany will suddenly know about your product. It doesn't mean that they will want to prescribe it. You have to reach the community. You have to make sure that the community will be using you, understand the benefits that you are providing, and that's the biggest challenge, I would say. Not technology, not regulatory, but simply sales and marketing strategy. How to reach your users, how to reach your stakeholders, how to reach your PhDs, which is a very specific professional group. It's not easy to enter that community. You have to have some strategies in terms of having ambassadors on board, like PhDs, for example, that can talk and relate to their peers, and that's, I think, more challenging rather than building technology part, because when you are after an MVP stage and then later you will see that technology is kind of like becoming something which is okay, we just need to maintain it at new functionalities, but it's becoming less and less important in terms of the priority of the challenges that you are going to face.
Awesome. So but like maybe I would ask a follow-up question here. So when those kind of people are like, let's say the partners are so important, like, is there a good recipe for maybe a founder watching our show today? For example, they have been like, now they had the idea or maybe currently already working on it and they realized like, okay, I have to have that balanced team. Maybe I need that technical talent. There are so many companies out there, that maybe can provide different services. Um, you know, outsourcing technology from any country or even out of the European. What is maybe the good way that kind of medical founder or especially non-technical founders, how they can really understand that this is a trustworthy partner, this is a reliable partner that they should partner with, and like go on their journey. Like, I mean, that they would maybe not that make that mistake, like the first mistake of getting the wrong partner. Is there good advice for founders having that challenge?
One thing is that if you are building a technical solution, a digital app, this is the focus of our meeting, so that I can relate to. If you are building a digital app, a digital product, then you have to have a technical person on board, and then depending on the internal discussion, on the budget, and many other things, you decide whether you want to go with your in-house team or you want to go with external partner. But crucial is to have, if you are a non-technical founder, and if you are building a technical product, the crucial thing for you is to have a technical person on board. So and then with that person, you have to create and think about strategy, how you want to build that product. That's one thing. I remember we had a question some time ago from one of the founders. What is the best technology to use to build a specific? They wanted to build a specific mobile app. What is the best technical framework or programming language to do that? And our answer was, well, the one that you have within your team. So there is no one best programming language or technology. It has to kind of like be aligned with your skills that you have within your team, and that would be the best technical solution. The best technical solution is the one that is the most convenient from the team perspective for you. So the most something which is most accessible for you. And when you want to outsource that, then there are simple things. It's about chemistry. If you talk to somebody that you want to hire, is just seeing how you will work with that company for several months or years. So it's good to have the right chemistry. It's good to make sure that there is the right competence set of skills in terms of the future scaling of the product. So it's good to kind of like look also a little bit ahead of your plan. It's good to look at portfolio, whether that company has done a similar project in the past. When we talk about medical software, then obviously you want to have somebody that is experienced within that area, that is certified, because, well, you will need to certify your product, and you want people with the knowledge how to go through the certification process, because then it's easier for you to place the product on the market in the future.
Yeah. So if it's your first rodeo, like find somebody who for whom it's not the first one, that they have really done it before and can prove it. And they can show it on the website. So thanks for that insight, and I hope that everybody now will get idea how to find those people. I see that Sandra, well, thank you so much for joining us today, but Christiana has one more question, and I think she's working on machine learning solution. So, what do you have any tips on organizing the development team of machine learning solution, where it's like software as a service that you have very different technical rules to coordinate how to make it happen? I think it's also maybe I would even like extend the question a bit. Are there any good tips that maybe when people they have been doing PhDs, they are working alone, and now maybe they have to become the manager of the small team and especially managing the technical team? uh, what's the kind of good recipe for managing technical teams that they would actually get work done together, and how to balance those technical teams well?
There is a nice quote for that. So, culture eats strategy for breakfast. I think that was the quote, which means, especially when you are a small company or a young company, um, and I think that the important thing is to make sure that people who are joining the team understand the culture we have within the team and are a good fit for our culture. So if we gather 5, 6 different people of different competences, but who are a good fit from the culture perspective, there is a bigger chance that they will perform better than those who are kind of like a best specialists, but are not in line with our internal values and culture. And so that would be the one thing which doesn't mean that it's going to be success, but at least you're making sure that the team will understand each other and then will respect each other and then will help each other if they follow if they understand what is the company's culture and values, and they follow it. So that's one of the things that I would suggest. Obviously, then it's very, again, Christiana. My answer is it depends. It depends what specifically type of skills you require, and then usually AI specialists they work along with regular software engineers, and that's nothing uncommon, I would say. So if you are a technical person, or if you have a technical person by your side, a co-founder, a technical co-founder, a CTO, or somebody that is advising you, then that's probably the person that should be responsible for kind of like mapping the skills and making sure that the team is composed of the people that will be required by the product development in the future.
And and maybe to follow up this one, maybe hard question, is that you said that the cultural fit is really important. Maybe what happens when the people, let's say, okay, you maybe kind of get the person, you put the team together, but you see that things are misfit, and you would actually need to maybe fire a team member or get rid of the team member uh, because things don't work out. How would you maybe do that, or how these kind of young founders who are maybe this is their first team where they are serious, they're working on startup, how that should work? So should they kind of wait for another 6 months to see maybe things work out, or like when they see that things are not moving in the right direction, when is the good time of changing the players in that team?
Usually when you kind of like ask yourself that question, it's too late. So what you can do to avoid, or at least to decrease the risk of that happening, is to have a open line of communication, and be happy about feedback that is coming from people, and encourage feedback, and feedback. My understanding is that feedback cannot be good or bad. Feedback is feedback, right? You see that something is not working, you provide feedback how this can be fixed. And usually that is enough. So nothing is piled up, and small issues are not becoming problems. And I would really encourage, and especially, I'm not sure if I hope that to some extent we as a company we are on that level, but probably we have a lot of to improve as well. But I hope that people in our team members, they they feel comfortable with sharing feedback with us, the founders, saying we think that something is not working, or we think that this should be changed. We try to encourage it, and obviously not to be offended that somebody is saying that something is not working. It's great when people are actually coming saying that something is not working or something can be done better. It's sometimes it's kind of like a hiding your ego and be open to. And when you as a founder show that you are open to get this feedback, also that something is not working, then hopefully the team is also kind of like solving the problems within the teams by themselves as well. But if you see that something is not working, somebody is doing a bad job within the team, then if that's something which is kind of like completely against our culture, then you have to fire that person. But sometimes it's not about being a bad will. Sometimes it's not kind of like a less understanding of something, or we do not communicate something very well. Then it's just simply to if you get the feedback that something is not working and that something is connected with one of the person within the team, then simply talk to that person. If something is I would say a bigger thing, then it's good to give some time for improvement, right? And then say, okay, so let's try to fix it, and let's meet for in a week, 2 or 4 weeks. Let's see if we can improve that. And then if you haven't seen the improvement and you gave somebody a chance to improve, then probably and you still see the problem, then probably there is no point in waiting. It's better for everybody, but sometimes we want to spare one person and the whole team is suffering. So if you see that there is no improvement and you gave that space for improvement, then probably, well, you will need to make some harsh next steps to avoid even bigger problems.
Well, thank you so much for these words of wisdom. The harsh reality, sadly, is that we have been flying through an hour of discussion, almost non-stop, and I'm very sorry to say that we can only take one last question. So, if any of your audience you have the last question for Przemek, you can put it in the chat. In the meantime, um, maybe can you also say that is there a way that maybe somebody was not with us today but is watching the replay on the YouTube at the EIT Health Innovators Community YouTube channel? Is there a way that they can reach you out, and if they want to follow up with any particular question, what's the best way to reach you out if you're open for questions from our community also after the session?
Of course, very good point, Timo. I'll be very happy to address anything that was discussed on the meeting today, or maybe not. So the best way to reach me would be LinkedIn. That's the best way to reach out and share if you have any comments, highlights, or simply would like to discuss something. I'll be very happy to talk or share some insights or to learn. I'm not so sure about the words of wisdom, Timo, but thank you for expressing this way. But I'll be very happy to hear if people were kind of like getting some interesting insight from today's meeting. I'll be very happy to learn also if somebody has something to discuss or would like to add or comment. I'll be very happy to follow up after the meeting as well.
Well, I mean, everybody, if you found today's meeting great, you can use in Air Meet. You see the emoji button just under me and Przemek. You can show the love to this session through the emojis, and I see the emojis are flowing in, thumbs up and hearts, so you can see how useful the session has been. And also, if you're watching the replay, don't forget to share this love by clicking like on the YouTube. And the great thing is that you can also share this video later with your friends, maybe a colleague of you, or or somebody else that you know that is struggling with with building the healthcare apps in the European Union, that to share this video with them, and they can maybe also follow up with Przemek. We will put the his LinkedIn link also in the video description, so you can click it just under the video in YouTube, and you can follow up. One more thing is that there is also a feedback survey for today's session. So if you go to the chat of AirMeet, you can see that we have just posted the link for the feedback survey. We would be very happy if you go there. It just takes a few minutes, but the feedback is very valuable for us to carry on with next episodes of the series and to have more events. And in a few, my colleague will also post the link for the next session that the EIT Health Innovators Community is having, that you can click on that link so you could register for the next session that we have there for you as well. And don't forget to share it also with your friends in the social media, because all of the virtual events of EIT Innovators Community are free of charge, and anybody can just dial in and pick up these words of wisdom. And today's session, we learned that Przemek said, like, firstly, find the balanced team. So know what are the gaps that you have in the competences. If needed, find a mentor or a service provider, and then be also aware what are the regulation requirements, and definitely also involve your stakeholders from early on, so that they would give feedback, and you would not just build a product in like alone in your lab or basement or garage, wherever you're innovating, but be out there together with the patients, with the healthcare providers, and hopefully also the ones who are paying, those insurance companies or somebody else. And during the session, you learned that what are the different insurance schemes that you can already subscribe to, and also how you can put together your team, and also, if needed, have that relevant feedback, and if really needed, to let it go. Before we let go the session and our participants today, what would be the very last word of wisdom that you would like to share with our participants here today?
Maybe something which is not quite obvious, especially when we think about the webinar touching practical things. Sometimes it's good to learn in terms of read books, listen to people like we today. But at the end of the day, it's also getting things done. It's kind of like sometimes you have to make your own mistakes and be kind of like a open and hope that it's not going to be a fatal mistake. But what I have noticed is that persistence is the best way to achieve goals, and then kind of like doing things is better than waiting. But also, and that would be my kind of like the end. The last thing probably to say is that sometimes you also have to know when to say stop. So if you are failing too many times, if something is not working, it's not about making that for forever. Sometimes you have to know when to let go, because that's also something which is good for your mental health. And mental health is kind of like crucial for your healthy product. So that's probably something which is, and that's also, I'm talking also from my own experience. So it's kind of like take care of yourself, and that's the best way to achieve success with your product.
Awesome. So thank you for summing it up in a very nice way, and sadly all good things come to the end. So this is also wrapping up our session today, the Coffee with the CEO, Season 2, Episode 1, Mistakes to Avoid While Building Healthcare Apps, together with Przemek Grzywa, the CEO of Revolve Healthcare. I hope you enjoyed this session, and if you found this session awesome, also share it with your friends, the replay on our YouTube channel. So feel free to do it. And as said before, if you have some extra questions for Przemek, just follow the LinkedIn link below the video to get connected, and you can ask more questions, or maybe even get Revolve as your partner building your next great unicorn in the healthcare space here in Europe. And also don't forget to check out other events happening at the EIT Health Innovators community at community.eithealth.eu. Thank you everyone for watching us today, and see you soon again in the next episode.
Thank you, Timo. Thank you all. Bye-bye.
Bye. We are going to get backstage now, I think.